Okay, so I'm basically going to give you an example of a disease or an illness whereby gene therapy has been applied and has produced, well, high efficient and I would say much success. So it is cystic fibrosis. Hopefully, some of you have heard of it. So it is actually a very common inheritable disease characterized by the exocrine gland dysfunction. What it means is that, okay, you, not to say you, sorry, the person having cystic fibrosis, okay, will have chronic lung disease and, well, digestive problems. But of course, regardless, okay, it does not affect their intelligence or appearance. So what makes CF a great candidate for gene therapy is that because in patient of CF, both gene pairs are actually altered or changed. So that means that not only one part of it. So if you remember, for a gene there are two alleles. In this case, okay, both of them, not only one. But before that, let's just take a look at what are the symptoms of cystic fibrosis. So cystic fibrosis actually affects people of various ages. Okay? So it can start as early as a baby. For example, the first one is meconium ileus, whereby a baby born with meconium blockage of the bowel. It either means the baby doesn't have an anus, okay, the hole to release the feces, or basically there is a blockage there. It has an anus, but the feces is not being released properly. So one of my cousin actually has this disease when he was born, so he has to go through a surgery just to create the anus to release the feces at less than 2 weeks old. So the second one is the bright bowel or echogenic bowel, whereby detection of meconium ileus in the uterus. That means that everything is fine, the anus is there, okay, but then probably there would be a blockage, okay, in the uterus. So third one is the repeated respiratory infections of the lungs and sinuses. So if you have prolonged sinuses, you may want to check it out, especially when you have hard time breathing as well. The fourth one, abundant respiratory secretions, which means that you basically produce a lot of phlegm. Frequent chronic cough, wheezing, but not to be confused with asthma. Nasal congestion, dehydrates easily, and vitamin or mineral deficiency, and sometimes could have a GERD or gastroesophageal reflux disease. So, there are other symptoms, but these are the most common for cystic fibrosis patients. So, those having CF usually have basically the respiratory and gastrointestinal systems usually have some form of kind of like an effect, and this is of course okay, with varying degree. For example, in terms of the respiratory, sometimes they may have a pseudomonas infection. So, well, go look up on what pseudomonas infection does to your respiratory. It's actually not good and quite ugly. Okay, go look out on it. Secondly is sinuses, which is quite common. And at the most part, sometimes you could have lung complications or damage. And asthma is also quite common for CF patient. For the gastrointestinal system, pancreatic insufficiency could occur, liver disease, primary biliary cirrhosis, gallstone, and also abdominal pain. And in terms of other symptoms or other effects, okay, sometimes they could have arthritis or diabetes or infertility or osteoporosis. Now, as I said, this disease affect people of all ages. Usually, daily medication is needed. It is necessary. So, for gene therapy, a type of gene therapy in terms of aerosol has been administered, which involve inhalation of aerosol with millions of viral particles through nebulizer. If anyone has had asthma problems before, you would know what a nebulizer means. If you see people go through surgery, okay, a mask is being put on top of them. Okay, a nebulizer is more or less similar to those kind of device. So virus will carry functional gene to replace the abnormal gene, and it takes about an hour or so to be delivered to the lungs via plastic tube in the mouth. Because when you inhale, it goes through your esophagus, through your lungs. So now, that is one example of the disease for gene therapy. There are other diseases, but I'm just going to more or less summarize, okay, on the types of vectors with current difficulties. It has been basically noted, okay, for some time ago and up until now, and it involves both of them, viral and also non-viral vectors. So you will see that a lot of it actually affect the viral vectors. So the difficulties in viral vectors are the vectors tend not to dispense well or have unpredictable insertion, especially if not manipulated well. Even then, sometimes virus has a mind of its own. And even though through direct injection, they are sometimes prone to miss some of the targeted cells. They could wander off somewhere else. Its use does not guarantee long-term gene expression, even though for some of them, well, very high efficiency. And recognition by immune system, a lot of them actually has this problem. Replication conditional virus vector kill tumor cells, but still did not cure cancer patients. And that is one of the problems that gene therapy has encountered. The sixth, some virus retains its ability to replicate, which is dangerous to the patient and the handler. Transcriptional inactivation in vivo. No single viral vector system is optimal for replication. That is actually the most difficult problem, number 8, okay, because sometimes they may need to combine two, okay, whereby I will explain to you later, okay, whereby they have a therapy where they combine two vectors, the viral vectors. For the non-viral vectors and the difficulties, of course, the first and foremost, as you can see from the examples in the first video, limited cell targets, and mass production is still difficult for some, not for all. Low efficiency of gene transfer and transfection because of the nature of the vector itself. However, safety concerns is low, but there is still some, especially with the use of tumor cells, because you do not want the patient to contract tumor later on. So a number of different viral and non-viral vectors are being studied for the research of potential gene therapy vectors. So among improvement in terms of the viral vectors, based on difficulties encountered, multiple vectors. We have retro-adeno combination package, okay, within the adenovirus backbones. It is called an retro-adeno or adeno-retro gene therapy. So mouse tissues with different tropism have been used with virus to reduce transcriptional inactivation in vivo, and various tissue-specific vectors have also been identified to be used to increase the chance of better delivery. Incorporation of human helper cells to increase virus stability and also for expression. Among improvement of non-viral vectors, incorporation of viral surface glycoproteins to improve cell attachment for liposome, because liposome sometimes does not get to the target cells. Using Eugenics-An to directly inject particles into cells, but that means that the cells are to be taken out and then delivered back via surgery. Coupling DNA to synthetic ligand or protein to improve target specificity. This is in the work. Hopefully it will be much better. And this has been for some time. Scientists are also searching ways to install the 47th chromosome in human to ensure that it could act as a backup, okay, if there is any case of disease or there is a need for gene therapy to be introduced into one of the tissue cells. Alright, so to cap off this video, I have one activity for you. So don't ask me where activity 4, we don't have activity 4, but you're going to have your pop quiz on Tuesday. So activity 5, okay, is actually about, okay, answer this question. What other diseases could gene therapy be applied to apart from cystic fibrosis? So list them down. And would you recommend gene therapy to the public or your family and friends? So you either have, okay, for second question, yes or no, choose only either one and prepare for the answer. We will discuss it on Tuesday after your quiz. So the first half hour you're going to have your quiz, second half hour we're going to discuss activity 5, so prepare for that. So enjoy it, and well, let's discuss later next Tuesday.